Hello everyone and welcome back to Let's Talk Sarcoidosis. Today in the studio I have one of my favorite physicians, and I know you viewers love him too. He's coming back now for about the fourth time to keep helping us get information and accurate information about sarcoidosis. Today back in the studio I'm welcoming Dr. Edward Chen from the Sarcoidosis Clinic at Johns Hopkins. Thank you so much, Dr. Chen, for coming back.
Oh, of course. Thanks a lot, Dorothea, for this opportunity to talk more about something we think about a lot.
Yeah, absolutely. And it's so much about sarcoidosis. It just seems like we can't get enough information.
Okay.
So what I wanted to know, Dr. Chen, what is the latest research now regarding sarcoidosis?
Sure. Well, I guess just to kind of begin this discussion, as we've kind of talked before, that sarcoidosis is a disease that involves inflammation, which simply is a term that we use to describe that the immune system is active. I would have to say that what we've realized, or for those who are actually actively trying to do research in sarcoidosis, is that this is actually a very complicated issue. And we know that there's no one research center that is going to ultimately find the answer for sarcoidosis.
Geez, okay.
Yeah.
So the other question that I have, how do you start to sort out sarcoidosis?
Right.
Just in general. And I have a two-part question to that, but just initially, how do you even sort out sarcoidosis?
Right. So, So as I'd mentioned, since sarcoidosis or the big question of what is sarcoidosis is such a difficult one, and we know that we can't really answer that one question head on. The research community has realized that really the only realistic way to tackle the big question is to break it down to smaller questions or simpler questions that could be more realistically answered. And so, I guess in terms of approaches to this, and we can categorize general approaches to thinking about sarcoidosis maybe in 2 or 3 categories. One would be, the traditional basic science approach, basically meaning that looking for genetic and molecular reasons for why sarcoidosis happens, with the thought that if we found something that was wrong with the immune system in sarcoidosis, something special to sarcoidosis, then we might be able to find a different way of treating sarcoidosis. Another way would be to study how sarcoidosis might impact the lives of patients with sarcoidosis. It's a very important issue. And ultimately, an important goal would also be through any research program, can we bring it back and improve the way we treat patients with sarcoidosis?
That's very interesting. I was also thinking about research, if we can just touch base a little bit on that. And I think for me and maybe the viewers, for research, you think about all the scientists being in the lab and with the white coats on and
Right.
doing the cell testing and things like that. With the test tubes and
Right.
and et cetera.
Right.
So how do we look for answers regarding research and, just basically how is it done?
Right. So yeah, I would agree that what you described is the usual way that most people think about scientific or basic research, even research that relate with sarcoidosis. And as I mentioned before, there are many. In terms of breaking down the big question of what is sarcoidosis into smaller, easier questions to answer, this has resulted in different projects being conducted by different groups across the United States and across the world, actually. So, for example, in the United States, in the Western United States, we have groups such as the National Jewish Health, in collaboration with the University of Colorado. They've been trying to study what immune cells are active or what immune cells are involved in sarcoidosis inflammation. And sort of related with that would be the group at the University of California at San Francisco at UCSF. They focused on just taking that one step further in terms of what genes are actually being expressed by these cells that are active in sarcoidosis. On our side of the Mississippi at Vanderbilt University, the group there has been very interested in seeing how environmental exposures might affect the way the immune system behaves in sarcoidosis. And here at Hopkins, we've been interested in studying certain chemical signals that might, steer or essentially control inflammation in sarcoidosis.
Okay.
Yeah, so different groups have tried to tackle these more scientific questions, and again, in much more focused manner.
Right.
Yeah.
So tell us what's the basic active research that's actually being done right now? I know you just named some things, but are there any others that are just what's happening right now?
Well, I guess in terms of other projects perhaps,
Mm-hmm.
or other ways of approaching this.
Mm-hmm.
Well, in addition to basic science efforts, as I mentioned before, it's also important to try to study, how the disease may be impacting patients with sarcoidosis, or even in terms of what sarcoidosis looks like, for example. And what I mean by that is even something as simple as trying to account for what parts of the body might be involved with sarcoidosis represents an important body of research, reflecting on how patients might be experiencing sarcoidosis. So, for example, we know that different patients may have involvement of different organs with sarcoidosis, and thereby, and because of that, many patients may have different symptoms associated with their sarcoidosis. And so, for example, the lung, is the most commonly involved organ in sarcoidosis. And so in many cases, a lung doctor might be an important person to help take care of patients with many patients with sarcoidosis. The next group of commonly involved organs will include the skin, the eye, and the liver. And because of that, many doctors, know to kind of try to look for evidence of sarcoidosis in those organs. And it's important to continue to study and catalog organ involvement carefully, just because the better we are at detecting, where sarcoidosis is and how the extent of the sarcoidosis, I think it helps with improving awareness of sarcoidosis amongst other doctors. And also just basically helps us paint a better, more accurate picture of what sarcoidosis looks like in the general community.
Right. Well, those are some very interesting scientific projects related with the immune system. Yeah. How are these affecting patients, Dr. Chen, with sarcoidosis?
Right. So it's a very important issue. So obviously we'd like to know what causes sarcoidosis, but just as important is what the patients are experiencing. So, as I mentioned before, it's important to try to account for where sarcoidosis might be, just because it probably has a big impact on what symptoms a patient might have. On the one hand, it's not so surprising, for example, if a patient has sarcoidosis in the lung, that they may experience shortness of breath and certain symptoms related with that. Right. On the other hand, there's certainly some other symptoms like fatigue that we know is being reported by patients, but it hasn't really been studied very well, or sort of described in a quantifiable way. And so there are certainly some investigators, for example, in the Netherlands and in the University of Cincinnati, that have been trying to find ways to standardize the way we identify and measure fatigue in patients with sarcoidosis. And it's an important issue. I mean, for example, we often will judge how well treatments might work based on lung function tests and other things that we think we're measuring. We don't do probably as good as a job asking patients or figuring out how differently a patient might be feeling with the treatments that we have today.
And that was my next question. I was actually going to ask you, do you feel that all patients are affected in the same way?
Um, so no, I mean, that's certainly an, an important issue, that either because some patients may have different organs involved and thereby, again, have different symptoms. But, if you were to look at the, 4 patients with just sarcoidosis in the lung, each one of those 4 may give you a different account of as to what they're experiencing. So to try to get into this issue, particularly since sometimes patients may not be feeling well because of the disease itself, or maybe because some of the problems they're having are for the medications. There's been an effort from the Albany Medical Center in New York, where they've been trying to assess more systematically the impact that sarcoidosis might have on patient quality of life. And so if we have better instruments of trying to, again, trying to measure or describe more uniformly how sarcoidosis might be impacting how patients feeling, and we might be able to treat our patients better.
Right.
Yeah.
And Dr. Chen, since you've been on here last, I was saying before that so many people that I know of that have succumbed, unfortunately, to this disease.
Oh.
And so my question is, if the studies know that, sarcoidosis is affecting all the organs in the same capacity, or as well as people feeling fatigue, and they already know this because of the studies, then why are the studies why are they still focusing on things that they already know?
Right. So some of the things I mentioned, like trying to find ways of measuring fatigue, it's not to say that we're discovering that fatigue happens in patients with sarcoidosis. It's really to try to get a better measurement of the problem. Because if there aren't ways of measuring how bad fatigue is or how frequently we find fatigue amongst patients, then again, it doesn't become a focus of even like how we treat patients. We're not going to necessarily focus on that because we don't know how to describe it. So that's one issue. So, and that will trickle down in terms of how we use our current medications, for example. Right now, as you know, one of the goals of research, particularly scientific research, has been to try to find something specifically wrong with the immune system in sarcoidosis, because the ultimate goal would be that, well, if we find something that's different about the patient's immune system in sarcoidosis that makes it different than, say, other diseases that also involve inflammation, if we find something specifically different with sarcoidosis, maybe we can then develop a treatment that's specifically tailored to sarcoidosis. If we also are, in developing a new treatment for sarcoidosis, we also can try to account for how the treatment is affecting the person's quality of life. Hopefully we can avoid some issues that we've had with our, prednisone or some of the other medications that we currently are using. So the thing is that, if we're, the reason why basic research has been such a priority is just that without finding something special about sarcoidosis, we're sort of left with using medications that essentially just simply throw a fire blanket over the inflammation that's being caused by sarcoidosis. And that fire blanket, as sort of alluded to before, is corticosteroids, namely prednisone, our fire blanket for sarcoidosis now.
So with the rate of the research, do you feel that the rate of sarcoidosis is now changing?
Well, I'm not so sure that the rates of sarcoidosis are much different now than, say, 150 years ago, when the first cases of sarcoidosis were first identified. But what it is that through the decades, as more patients have been identified by doctors who treat patients with sarcoidosis, through our own increased experience, cumulative experience with patients with sarcoidosis. Number one, there's been a growing awareness of sarcoidosis amongst doctors, which means that hopefully they're seeing more patients or finding more patients with sarcoidosis. and particularly finding more patients with what used to be thought less common, versions of sarcoidosis. And so with that, I don't think necessarily that rates of sarcoidosis might not necessarily be any different, but we're getting a much more accurate picture of what sarcoidosis looks like in the community.
And that's a good point that you brought up, because there are a lot of people that get in touch with me and say that they have physicians that really still don't understand the disease or not treating them accordingly. And there's some great physicians, such as yourself and other physicians, that do know a lot about it. So with that being said, I know that the viewers would be interested in knowing that the doctors themselves is it affecting the way that they treat patients now because of the research and having a better understanding of the disease?
Well, I think for part of our job, in terms of trying to learn more about sarcoidosis, is also trying to provide better information to other doctors and to patients also about sarcoidosis. And so, for example, as I mentioned before, there are certain organs that we know are more commonly involved with sarcoidosis.
Right.
But more recently, I think one of the observations has been that sarcoidosis in certain organs that may be more common than what we thought, and one of these would be sarcoidosis in the heart. Mm-hmm. So I think and this is really, again, it's not so clear whether or not the actual rates of sarcoidosis have changed, but we may be much more aware and much better at looking for sarcoidosis in the heart. I think within the last, say, 15 to 20 years, it's much more common for doctors to think about the possibility of sarcoidosis in the heart, and we actually do have some tests now to look for that.
That's good.
So that's one of the issues that actually, just because of accumulated experience with patients with sarcoidosis, that probably we have a better understanding that sarcoidosis in the heart, cardiac sarcoidosis, might affect maybe as many as 1 of every 5 patients, about 20% of patients. Wow. with sarcoidosis. So just to give some rough numbers, if we had 10 patients with sarcoidosis, we probably expect maybe 8 or 9 of them to have some evidence of it in their lungs, and then maybe 3 out of the 10 patients might have sarcoidosis in the eye, liver, and skin, the next common
Right.
organs, and then maybe 1 or 2 of the 10 might have evidence of sarcoidosis in their heart. So it's lower, but it's not insignificant.
Right.
And again, that observation's only been possible just through careful cataloging of how patients are experiencing their sarcoidosis.
Well, that's some really good, interesting information regarding sarcoidosis of the heart. With that being said, has that actually changed the way that patients have been taken care of?
Oh, right. So, if we know that sarcoidosis in the heart is a little bit more common, and because of the consequence of patients, if they have sarcoidosis in the heart, it becomes part of the list of things to check, in patients who are newly found to have sarcoidosis, or at least we need to ask the right questions to see if there's a possibility that it might be in their heart. Mm-hmm. Another, manifestation of sarcoidosis that also we have a slightly different view about nowadays would be something called pulmonary hypertension. So pulmonary hypertension, or high blood pressure of the lungs, is a problem that in the past was thought to only really involve patients who had very severe lung disease. But it turns out that we've seen, or just not we, but doctors who treat patients with sarcoidosis have seen a good number of patients who have pulmonary hypertension, but really not much structural lung disease. So this is a very important new revelation. And so, and the reason why it's important is because pulmonary hypertension certainly can end up being a silent cause of shortness of breath, and also contribute or add to many of the major complications that sarcoidosis can have.
Okay. I wanted to try to get a couple more questions in before the show ends. No, that's fine. Can you summarize the results of NIH and sarcoidosis workshop?
Oh, right. So the so even though I began, our discussion saying that many research institutions are sort of focusing on smaller questions, just because they're it's more realistic to be able to answer a smaller question. There certainly have been opportunities to try to see if we can team together to answer some more difficult or bigger questions in sarcoidosis. And so the National Institutes of Health, the NIH, which is like the largest funding source for research in the United States, actually invited many of the research groups, sarcoidosis research groups, to a conference last year. And we were all in the same room and had an opportunity to kind of discuss the state of sarcoidosis research today, and try to set some priorities as to what we might try to work on together. What was understandable would be that the priority still was to try to focus to make sure we don't lose sight of trying to discover the genetic and molecular reasons for sarcoidosis, because that essentially, if we found the reasons for sarcoidosis to occur, it still would offer us the opportunity to hit that home run and find a cure for the disease. But it was also brought up that it was equally important to continue to work on understanding the impact that sarcoidosis has on patients' lives, because that's the one thing that patients experience on a day-to-day basis. So that actually was important, because that aspect about sarcoidosis research probably had not been emphasized quite as much.
So that answers the question I wanted to ask you, like, is everybody working in silos, alone, or they're sharing the actual information?
Right. So actually through the NIH, there was certainly an opportunity to work on a project, or at least for some centers to work on a project together. There's the recently completed grad study was a project that involved 9 research centers across the United States, funded by the NIH. And the goal of the study was to try to try to recruit a larger group of patients, about 400 patients. And the way we were trying to get answers to sarcoidosis was to see if we can determine the impact of environmental exposures, the impact that environmental exposures might have on immune cells in sarcoidosis. And we would assess that by seeing what genes are being expressed by their immune cells, and matching up very carefully with their disease status. And so the hope would be, once we're finished, we're still kind of, grinding through the data at this point. The hope would be that by teaming together and looking at a larger group of patients, that we might be able to answer, or at least get some observations that a much more focused, smaller study focused on a smaller question wouldn't be able to answer. So there's more yet to come, hopefully, in the upcoming year.
Well, I hope so. And, if you get more information, I would love for you to come back again, Dr. Chen. As always, you're always welcome. I want to thank you again for taking time out of your busy schedule to be with me again today, to help the viewers understand this disease and their caretakers and families and friends. And again, thank you all for watching Let's Talk Sarcoidosis. As I always say, be well, stay positive. Please don't let sarcoidosis, or any other illness for that matter, to define who you are. Live well and be blessed. Thanks for watching.
All right. Thanks.